Assalamu alaikum. We are talking about the pharynx, larynx, esophagus anatomy. The pharynx is a funnel shape, musculo-membranous tube which is deficient anteriorly and situated behind the nasal cavity, mouth and larynx. Thus is divided into nasal, oral, laryngeal part. Its upper end is wider lining under the skull. So there is a relation between the skull and the oropharyngeal and the nasopharyngeal and the larynx, because the base of the skull is considered is the attachment of the muscles of these structures. As you see here, this is the 3D. You see here the trachea, the laryngeal apparatus, and this is the esophagus, and this is the link between the oropharyngeal and the nasopharyngeal. If you look to this picture here, you see the nasopharyngeal. This is the base of a skull, and this is the nasopharyngeal, and this is the oropharyngeal. This is the soft palate, and come down here to the beginning, the orifice of the trachea through the larynx, and the esophagus going to the stomach. Any question? The attachment, as we said, with the pharynx started from the base of a skull. This is the base of a skull. You see, if you look here, and even the palate is considered the part of the structure related to the base of a skull. The nasal cavity. Here, the foramen magnum and the glenoid fossa. You see, this is all the structure here related to the oropharyngeal, nasopharyngeal structures. If we look from the lateral view here, we'll see there is a relation between the lateral wall of the pharynx and esophagus here in this area through the pterygoid plate, medial or pterygomandibular raphe, and the other relationship is with the hyoid bone, and the third relation with the cricothyroid and the thyroid muscles. If you look here, the structure, base of a skull, and this is the trachea and the laryngeal apparatus, and the ligament, which is stylohyoid. If you look here, this is a relationship between the base of a skull and the hyoid bone, stylohyoid, plus the esophagus here. So we have the stylohyoid, and we have the relationship of pterygomandibular, and also we have a relationship with the base of a skull from this point. In addition to the muscular relationship, we have mucosal structure of the wall of the esophagus, the pharynx and laryngeal region. That which is we have mucous membrane is what is called pharyngeo-basilar fascia, muscles, buccopharyngeal fascia. This is the second layer of the fascia from inward. If you look here, you will see this picture, the same which is have a relationship from the base to the lower. This is what is called the extrinsic muscle and intrinsic muscle of the pharynx. We have extrinsic and intrinsic muscle of the pharynx. We have superior constrictor muscle, we have inferior middle constrictor muscle, and we have inferior constrictor muscle of the pharynx. As we said, this is the muscle superior, middle, and the inferior constrictor muscle. This area, the muscle are superior, middle, and inferior constrictor muscle. Their fibers run in the circular direction. If you look here, the circular direction, and they extend around the pharyngeal wall to be inserted into fibrous band or raphe that extend from the pharyngeal tubercle on the basilar part of the occipital bone from this area, you see, from this area, and also they overlap each other's, cause the previous picture, you see, from the base of a skull occipital region and to come down to the inferior constrictor muscle of the pharynx. The crico here, the cricopharyngeals, the cricopharyngeals is the lower part. Is the lower part. Here, the superior constrictor muscle, medial pterygoid plate, the origin, pterygoid humulus, pterygomandibular raphe, and mylohyoid line. While the middle constrictor muscle is a greater and lesser horn of hyoid bone and stylohyoid ligament, while the inferior constrictor muscle, arch of cricoid cartilage, and oblique line of the thyroid cartilage. Longitudinal, what we have salpingopharyngeus, cartilage of auditory tube, and we have palatopharyngeus, which is posterior border of the hard palate and palatine aponeurosis, plus the stylopharyngeus. It starts from the styloid process. The interior of the pharynx, as you know, it is a lining with the a mucous membrane that form the what is called the nasopharyngeal area. Nasopharyngeal area. This is what's called the nasopharyngeal area. There is an isthmus. The isthmus of which is هذه التنجة الاسthmus, you see, is the opening in the floor between the soft palate and posterior pharyngeal wall. This is sometime in a cleft palate patient, when we do the repair in the cleft palate, sometime a shortages in this area in the pharyngeal isthmus leading to what is called nasality. يقوم المريض يتكلم بطريقة من أنفه. السلام عليكم، شلونكم، شلون أحوالكم. هذه الصورة هو because the air will escape from the pharynx to the nasal cavity and losing the articulating in the tongue, what is called nasality. Nasality. Yani the resonance of the speech will be weak. If you look here in the internal auditory meatus, this one اللي هي بها قناة Eustachian tube, and also where we see here in this area pharyngeal, the depression pharyngeal, what is called pharyngeal recess, is the depression in the pharyngeal wall behind a tube elevation in this area, and salpingopharyngeal fold is a vertical fold here for mucous membrane covered by salpingopharyngeus. Any question? This is the nasopharynx area, nasopharynx area. While the oropharynx area, this is called oropharynx area. What we have a median glossoepiglottis. This is the epiglottis area, and this is what is the tongue. So glossoepiglottis fold is a midline fold, lateral epiglottis fold from the joanib, and valliculi. This is a depression on each side of the median glossoepiglottis there in this area, and palatoglossus and palatopharyngeal arch in this area. The tonsillar fold, this is the tonsil region here. The tonsillar area here, or called tonsillar fossa, in this area, you see, this tonsillar area, and the oropharyngeal isthmus. So we have nasopharyngeal isthmus and the oropharyngeal isthmus, you see, and the palatoglossus arch, in this area. Any question? While the laryngeal pharynx here, it's the relationship between the pharynx and the larynx in this area. If you look in the indicator, this is what it's called. So we have nasopharynx, oropharynx, and laryngeal pharynx. This is the three part. In the laryngeal pharynx, which lie behind the opening into the larynx, the lateral wall is formed by thyroid cartilage here, and the thyroid membrane. Piriform fossa is at the depressed of the mucosal membrane on each side of laryngeal inlet here in this area. This is laryngeal inlet, what is called the piriform fossa. The blood supply of the pharynx, it is ascending pharyngeal artery. Ascending pharyngeal artery is a branch of the external carotid artery. Branch of the ascending pharyngeal is a branch. All the supply of the pharynx from the external carotid artery, which is the ascending pharyngeal artery, tonsillar branch of the facial artery, branch of the maxillary and lingual artery, all involved in the blood supply of the pharynx. The venous drain, it is taking blood from the oropharynx collection and the plexus external to the pharynx, which is called pharyngeal vein, usually drain direct into the internal jugular vein, or alternatively what is called maxillary or facial vein. So we have two drain, whether internal jugular or it's a drain from maxillary vein or drain from the facial vein. You see, this is the area, and you see here the venous drainage of the pharynx. While the lymph drainage of the pharynx, it is going to the deep cervical lymph node, and retropharyngeal, this is the retropharyngeal here, retropharyngeal and paratracheal node in the deep cervical node. Any question? The nerve supply of the pharynx, it is formed from three parts, that which is called nasal pharyngeal from the trigeminal neuralgia, and oral from the ninth cranial nerve, the oral pharynx, and the laryngeal pharynx, it is a branch. So we have a three cranial nerve supplying the pharynx, which is one trigeminal through the maxillary branch, and the ninth cranial nerve through the oropharynx branch, and the laryngeal pharynx through the internal laryngeal branch of the vagus nerve. While the muscles supplied by the vagus nerve directly from the pharyngeal plexus, except انتبهوا هنا except the stylopharyngeus, which is supplied by the ninth cranial nerve, the glossopharyngeal. The pharyngeal plexus, if you look here, the pharyngeal plexus is formed by pharyngeal branch of the vagus nerve, pharyngeal branch of the glossopharyngeal, and pharyngeal branch from the superior cervical ganglion as a vasomotor. Any question? The oropharynx, which is a part of the digestive system. The oropharynx is part of the digestive system. As you know, that the roof is formed from the soft and the pharyngeal isthmus. This is the pharyngeal isthmus here, and this is the soft palate. The oropharynx is a part of a throat at the back of the mouth, behind the oral cavity. It includes back of third tongue. You see, this is the third tongue here, the third part, which is supplied by the ninth cranial nerve. You see the posterior pharyngeal wall here, and this is what is called the oropharynx. The oropharynx structure, which is soft palate, base of the tongue, posterior pharyngeal wall. then نحفظوهن انه part of the oropharynx, which is the soft palate, base of the tongue, and posterior pharyngeal wall. The palatine tonsil، هذه اللوزة الكبيرة اللي يسموها palatine tonsil، انه هي big mass. It is work as a guard to protect the body, which is called the two mass of lymphoid tissue located in tonsillar fossa between the palatoglossus and palatopharyngeus. Here, if you look here, you see, and there is some fibrous capsule separated from superior constrictor muscle by loose alveolar tissue containing external palatine vein descended from the soft palate. This is the soft palate. You see, ينزل lateral to the superior constrictor muscle, and styloglossus. This is the styloglossus muscle. You see, loop facial artery and internal carotid artery. The blood supply of the tonsil, the palatine tonsil, which is the tonsillar branch of the facial artery, and the vein pries superior constrictor to join the external palatine, pharyngeal, or facial vein. The lymph drainage of the palatine tonsil, which is a deep cervical node. Deep cervical node. Any question? While the nasopharynx defines the upper part of a throat behind the nose. It is a part of the pharynx which comprises three separated segments, which is nasopharynx, oropharynx, and hypopharynx or laryngeal pharynx. You see, so that the part. The nasopharynx is about 2 to 3 centimeter width and 3 to 4 centimeter long, situated behind nasal fossa, inside the occipital bone, and the person to breathe through the nose, and the soft palate separated the nasopharynx from the oropharynx, which is site just below the soft palate. The nasopharynx remain open when surrounding muscle flex, so that the person can continue to carry the respiratory function. The nasopharynx is surrounded by salpingopharyngeal folder, if you look here, and the tube of the tonsil to become, if inflamed or infection, that may be causing some difficulty in breathing. Also, there is an adenoid here. There is adenoid, what is called the third tonsil, nasopharyngeal tonsil. احيانا انه هذه بنصير very enlarged خصوصا بالاطفال اذا كبرت اللي ما تسمى بنشرة النفاس. اذا كبرت هذه, if it's become enlarged, it may be block the nasopharyngeal air passages. The child become a mouth breather, and sometime bending the neck forward and develop what is called malocclusion and cervical problem, because you want to compensate the breath through the oral cavity, and what is called the adenoid face. Adenoid face. While the third part, which is called the laryngeal pharynx, it is extended from the upper border of epiglottis. This is the epiglottis, you see, and to lower border of cricoid cartilage, C6, in the C6 level. You see the epiglottis, you see, and this is the lingual tonsil. If you look here, this is the soft palate, and there's the sagittal coronal section of the area. Here, if you look here, this is the sagittal section of the area, and you see the cricoid cartilage. You see, anterior wall, it's the inlet of the larynx, and the posterior wall bodies of the third, fourth, fifth, and sixth cervical vertebrae. This is from the posterior wall. The Walder's ring of lymphoid, Allah subhanahu wa ta'ala واقعا جعل حماية لهذه المنطقة باعتبارها المدخل إلى جسم الإنسان، فغذاها بكمية كبيرة من الليف نودز اللي هي عبارة عن حمية وجهاز استخباري وجهاز دفاعي للجسم. This is the most powerful defending system in the body. This is the ring. You see, all around. If you look here, all around, it's filled with the pharyngeal tonsil, palatine tonsil, you see, and the tongue, what is called the tongue here in this area, the base of the tongue also. All this as a like ring, you see, in order to protect. So we have three tonsils in ours, in addition to the pharyngeal tonsil. So we have pharyngeal tonsil, you see, and a tubal tonsil and lingual tonsil. All these ring of the protective to our body. This is the ring. If you look here, lingual tonsil in the base of the tongue. You see, a tubular tonsil and a pharyngeal tonsil and the normal tonsil in the oropharyngeal region. Any question? The esophagus is a tube formed from the muscles and membrane. The borders from the anterior, the trachea. Posteriorly prevertebral layer of the deep cervical fascia, longus colli, and vertebral column. Laterally, the lobes of thyroid gland and carotid sheath. Start from the oronasal pharynx, laryngeal pharynx, and connected to reach to the stomach. The food, the process of digestion, start from the mouth and come down by the swallowing to the esophagus and to the diaphragm here, what is gastric orifice, you see here, and to the stomach. The larynx هذا اللي احنا نحكي والصوت سبحانه وتعالى, it is more complex structure. You see, if look here, well protected by cartilages. You see, hyoid bone, cartilages, and the muscle in order to protect the larynx. Here, highly protected the airways through the epiglottis, and also will help, you see, in phonation, يعني بالنطق. The development of the larynx is occurred during the 4th week intrauterine life. The respiratory primordium appear in the floor of the foregut in the 4th week of gestation of the life. The larynx begin as a slit like diverticulum laryngotracheal groove in the ventral wall of primitive pharynx. The groove gradually deepen and its edge fuse to the form of sputum. This sputum separate the pharyngeal tracheal tube from the pharynx and esophagus. The process of this fusion starts caudally and extend cranially. Between the 5th and 6th week, 3 swallowing appear in the laryngeal otitis, the anterior swelling. You see, it divert the globotracheal eminence from the 4th arch, from the epiglottis. So epiglottis from the anterior swelling. The lateral arytenoid swelling appear derived from the 6th bronchial arch, move medially and form the T-shaped apparatus. The laryngeal lumen temporarily occluded at 8 weeks. هذه العملية تبدأ من الأسبوع الرابع حتى الأسبوع الثامن. By the 10th, بالأسبوع العاشر, week of gestation, recanalization occur and consequently pair of laryngeal ventricular are formed, and the laryngeal ventricle are bonded by mesenchyme tissue that condense and progress into false and true vocal cord. هذا التكوين أنه بداية الحبل الصوتي. Laryngeal cartilage developed from the mesenchymal of bronchial arch. The thyroid cartilage, which is from the 4th arch mesenchyme, as a 2 lateral plate meet in the midline arytenoid and corniculate cricoid cartilage from the 6th bronchial arch. شوف ايش قد معقدة العملية في تكوين اللارynx, and the instructing that the intrinsic الداخلي intrinsic laryngeal muscle developed from the mesoderm of the 4th and 6th. سبحان الله العظيم. كل هذه التشكيلة المعقدة هي أنه تتكون between 4th and the 10th week of gestation. Any question? The external feature of the larynx, located anterior to the 3rd, 4th, 5th, and 6th cervical vertebrae, extended from the base of the tongue to the proximal portion of the trachea. Laryngeal skeleton is suspended from معلقة from the hyoid bone by the medial and lateral thyroid membrane. You see here? This is the hyoid bone. وكيف انه هي معلقة بالhyoid bone. And the lateral lobe of the thyroid gland lie anterior lateral to the thyroid and cricoid cartilage. Isthmus of the thyroid بالوسط تصير رقبة الجلاند thyroid gland. Isthmus of the thyroid gland lie just below the cricoid cartilage and often covers the first and second tracheal ring. This is the tracheal ring. You see? Down the tracheal ring. The gross anatomy of the larynx is located within the anterior aspect of the neck, you see, and is suspended by, attached by the hyoid bone, and has a relationship, the primary function, to protect the lower airway by closing the trachea through the epiglottis, and also stimulation therapy, the halting respiration and prevention of injury of the foreign body. فاللارنكس تعتبر هو الواقي الأساسي. If you look here, this is the epiglottis and this is the hyoid bone. انه اي شيء هنا في هذه المنطقة اللي جدا حساسة، ولهذا احنا عندنا كراهية الكلام خلال الاكل لسبب انه حتى لا يفتح الايرواي، كراهية الكلام اثناء الاكل حتى لا يفتح الايرways. You see? And this is the structures of the larynx. The epiglottis, starting from epiglottis and the attachment with the hyoid bone through the membrane and the thyroid cartilage lamina, if you look here, and coronary cartilage here, and arytenoid cartilage, and muscular process, if you look here, with the vocal process here, and vocal ligament, and cricothyroid ligament here, and this is the, which is the thyroid location in this area. Any question? If you look here, the cricoid cartilage, this is the cricoid cartilage, is a ring of hyaline cartilage located at the inferior aspect of the larynx and is the only complete ring of cartilage around the trachea. شوف هذا كلش مهم انه هي هذه الرنج الوحيدة اللي هي around the trachea. It has a shape of signet ring with broad portion posterior to the airway, lamina of cricoid cartilage, and narrower portion crinkling anteriorly arch of cricoid cartilage. The posterior surface of the lamina contains two oval depression here, you see, two oval depression which serve as attachment site, posterior crico-arytenoid muscle separated by vertical midline ridge that serve as attached of the esophagus. If you look here, the lower border of the cricoid here, the lower border, you see, is connected to the first tracheal ring, to the first tracheal here, from this area, you see, and the upper border of the cricoid cartilage give attachment to the cricothyroid ligament on the anterior and midline. The cricothyroid muscle on the lateral aspect and the base of pairs of arytenoid cartilage in both sides of the posterior aspect here. The thyroid cartilage is the largest of the laryngeal cartilage. Thyroid cartilage is the largest of the laryngeal cartilage. It's formed by right and left lamina that are separated posteriorly and joined together at acute angle اللي احنا نسميها تفاحة آدم في هذه المنطقة. You see, Adam's apple with a prominent, and the laryngeal prominence is more appear in the main because the angle. حتى الصوت نلاحظ انه صوت المرأة انعم من صوت الرجل because the angulation here. The superior thyroid notch, this is the superior thyroid notch, which is called V-shaped notch immediately above the laryngeal prominence, while the inferior thyroid notch is less distinct. هذه اللي هي inferior, you see. The two lamina are quadrilateral in shape and form the lateral surface of the thyroid cartilage that extend obliquely to cover each side of the trachea. The posterior aspect of each lamina is elongated to form the superior horn. This is the superior horn of the thyroid cartilage. The inferior border of the thyroid cartilage is attached to the cricothyroid, If you look here, you see, in the midline and the cricothyroid muscle on either side. This is the cricothyroid muscle. In each side. And the superior horn along with the entire superior edge of the thyroid cartilage is attached to the hyoid bone by the thyroid membrane. You see, this is the thyroid membrane. Any question? The composition of the larynx, the epiglottis, arterial cartilage, and corniculate cartilage, Artery, epiglottis, folder. You see, this is all the structures of the larynx. The epiglottis is a leaf-shaped cartilage. This is one. هذا هو البوابة الحقيقية التي تمنع دخول الطعام وتنفتح خلال خروج الهواء والفوكال كورد يكون في هذه المنطقة. Arytenoid cartilage is from the part of the larynx to which the vocal ligament and vocal cord, they are pyramid in shape and have three surfaces, a base and the apex, you see, and they are located superior to the cricoid cartilage, The posterior surface of arytenoid cartilage give attachment to the arytenoid muscle, if you look here, and the attachment to the fourth vocal cord, vestibular ligament, and vocali muscle. The medial surface has a mucosal lining that form the lateral aspect of the respiratory part of the glottis. The apex of the arytenoid cartilage is pointed and articulated with the corniculate cartilage. If you look here, this is all the structure of the larynx. And this is the types of the cartilages, which is the hyaline cartilage. And this is the relationship between the larynx and the hyoid bone and the floor of the mouth. The hyoid bone You see, U shape. Its anatomic association with the laryngeal apparatus. If you look here, located in front of the third cervical vertebrae, serve as attachment of the larynx via the thyroid membrane and the extrinsic muscle of the larynx. The hyoid bone is suspended from the skull base temporally or temporal bone via the stylohyoid ligament. Is a U-shaped bone with the body, two lesser horn and two greater horn. This is the greater horn and lesser horn. This is the lesser horn, and this is the body, and this is the greater horn of the hyoid bone. If you look here, on ligament attachment, what is called the thyroid membrane plus the thyroid and thyroid. This is the attachment, thyroid, the membrane. You see, it's from a box, and this is the ligament, and here in this area, which is located the thyroid gland. This is the intrinsic ligament of the larynx and the attachment between the hyoid bone and the larynx. This is the intrinsic ligament. If you look here, the thyroid rests here. If you look here, this is the ring, cricothyroid. The thyroid rests superiorly on the cricoid and attached posteriorly laterally at the cricoid inferior articular facet here in this area, and this is the ring of a trachea. The laryngeal cavity. laryngeal cavity هو هذه منطقة الصوت اللي يشوفوها. The laryngeal cavity central is a tubular in shape and lined with mucosa. The superior aspect of the cavity, laryngeal inlet, open into the pharynx, inferior and posterior to the tongue. The inferior aspect of the cavity is continuous with the lumen of the trachea. The laryngeal cavity may be divided to three major regions: the vestibule, the middle, and the infraglottis aspect. If you look here, the infraglottis space is the lower portion of the cavity in between the vocal fold and inferior opening of the larynx into the trachea in this area. Look here. Subhanallah al-Azim. This is the vocal cord here, and this is the rima glottides اللي تمثل البوابة الحقيقية إلى التراكية. Muscle of the larynx, cricothyroid muscle, and the function in order to elevate the anterior arch of the cricoid cartilage and depress the posterior portion of the thyroid cartilage lamina. This produces tension and elongation of the vocal cord, resulting in higher pitch of phonation. إذا نريد نصيح فهذا الشغل يكون شغل اللي راح يكون cricothyroid muscle supplied with the vagus nerve. Lateral cricoid muscle is one of each side and from the upper border of each cricoid cartilage to the muscular process of the arytenoid cartilage on the same side. These muscles' function is to rotate the arytenoid cartilage medially and thereby adducting the vocal cord, and the lateral cricoid tenoid muscle receive an innervation from the cervical or from the vagus cranial nerve, from the vagus nerve. Transfer arytenoid muscle, which is the single muscle, and that extend between the posterior surface of each arytenoid cartilage. Its main function is abduction of the vocal cord, and it's innervated by both recurrent laryngeal branch of the vagus nerve. The thyroarytenoid muscle run from the vertical line on the anterior surface of thyroid cartilage, angle and adjust to the external surface of cricothyroid ligament, to the anterior lateral surface of the arytenoid cartilage. Each muscle consists two parts, the vocalis and the thyroepiglottis part. The vocalis is lie deep inferior parallel with the vocal ligament. It's attached posteriorly, and the thyroepiglottis part is occasionally described as separated muscle. It lies superior and continuous into the epiglottis fold, where some fibers extended to the margin of epiglottis. This muscle function to draw the arytenoid cartilage forward, thereby relaxing and shortening the vocal cord, while also rotating the arytenoid cartilage, you see, inward, thus adducting vocal fold and narrowing the rima glottis. The thyroid arytenoid muscle receive innervation to the vagus nerve, from the vagus nerve. You see, most of the laryngeal muscle are supplied by the vagus nerve. So this is the nerve of the larynx, as we said before, the superior laryngeal nerve, recurrent laryngeal branch of the vagus nerve, the vessels of the larynx are from the external carotid artery, and the veins, superior and inferior laryngeal vein, drain the larynx and share the same course as arteries. The superior laryngeal vein drain into the superior thyroid vein, which empty into the internal jugular vein. The inferior laryngeal vein drain into inferior thyroid vein, which is both empty into left and brachiocephalic vein. The lymphatic vessels that drain above the vocal folder have a long superior laryngeal artery and drain into the deep cervical lymph node at bifurcation of the common carotid artery. The lymphatic vessel that drain below the vocal fold travel along the inferior. So we have a two part. One, it is above the vocal, and one, it is toward the vocal. For the drainage, travel along with the inferior thyroid artery and drain into the upper tracheal lymph node. Any question? The functional anatomy of the larynx هذه مهمة جدا، انه في عملية انه شلون how to close, how to open, and the importance اللي قلنا انه كراهية الكلام وقت الاكل، انه باعتبار انه راح يصير sharing، انه هذه تنفتح والاوروفارنجيال مفتوحة، بهذه النتيجة انه يكون الفارنكس مفتوح واللارنكس مفتوح، ويصير عملية الاختناق. لذلك أنه العملية بالسوالوينج يجب أنه أو بالأكل يجب أنه تكون حالة من الصمت in order to control the swallowing process. During respiration, the rima-glottis, rima-vestibule and vestibular are open. The vocal cord may be further abducting during force في عملية النطق أو في respiration by action of the posterior cricothyroid muscle, and thus you see cricoartinoid muscle, thus widening the rima-glottis and increasing the diameter of the laryngeal airway. You see كم مفتوحة هذه العملية انه هذا الفوكال كورد. بالفونيشن كذلك النطق والريسبيريشن وعملية الرياضة كذلك انه نستخدم هذه القضية حتى يصير تنشن ولا يصير انه مشكلة no as a guard. So we have انه الفانكشن اللي موجود بالاناتومي اوف ذا لارynx هو يفيدنا بالسوالوينج ويفيدنا بالفونيشن ويفيدنا بالريسبيريشن. كذلك في عملية الإفوت rima-glottis is completely closed and forcefully shut the airway حتى انه يصير tension. There is a difference between the adult and the children larynx. هذه هي الديفرنس اللي تكون انه الحجم والdevelopment of the children and the adult, and there is a difference between the male and female larynx. Any question? Thank you very much.